Hi, my name is Lisa and I'm from RT-102 and I'm here to demonstrate 5 views of the knee. They include the AP oblique with medial rotation, the lateral view, the axial projection camp-covering method, and the tangential projection, the axial projection camp-covering method for the intercondylar fossa, and the tangential projection Setagast method for the patella. A ballpark range for these projections of the knee is between 65 to 75 kV and a mass of 5 to 12. Depending on my patient's distance of her as-is to the table, I will be angling my tube accordingly. So as I was passing the waiting room, I noticed my patient, and I decided that the distance of her as-is to the table was greater than 25 degrees, so I'm going to be using a tube tilt of 3 to 5 degrees cephalic. So the first thing I'm going to do is set up my room. I'm going to detent my tube. And I'm going to measure 40 inches for my SID. And as we're here, since I know the distance of my patient's as-is to the table, I'm going to angle my tube to a 3 to 5 degrees cephalic. Okay. Next, I am going to insert my cassette into the bucket. And line up my bucket. All right, now I'm ready to get my patient. I'm going to get my requisition. I'm going to verify the information with the doctor in the computer, and I'm going to enter my patient's last and first name, date of birth, and my patient's gender. My technique for my patient today is going to be a 70 kV with a 5 mass for my AP view. I'm going to enter the views that I'm doing, which will be an AP oblique with internal rotation, a lateral, a tunnel, and a sunrise. So I'm ready to get my patient. Okay. All right, Mrs. DeWitt?
Yes.
Hi there.
Hi.
I'm Lisa from the radiology department. How are you today?
Good, how are you?
Good. Yeah, good, thank you. Can you please tell me your first and last name again, please?
Elena DeWitt,
Okay. How about your date of birth?
22575.
Okay. Any chance you're pregnant today?
No.
Okay. So we're looking at some x-rays of your knee. Is it your left knee?
Yes, my left knee.
Okay. Have you had any surgeries?
No.
Okay. All right. Well, the first thing I need you to do is I need you to take this gown and go ahead and put it on, and put the opening to the back. Take everything from the waist off down, and then meet me back here, and we will proceed.
Okay.
Okay. So go ahead and.
Okay, sure.
Okay. So as my patient's getting ready, I want to recheck my console to make sure that my kV is at 70 and my mass is at 5. Okay. Okay. Mrs. DeWitt, you ready? Okay, come on in. I'm going to have you go ahead and lie on the table on your back, please.
Okay.
All right. So the affected leg is fully extended, which is our left leg. Our leg is straight. My central right inferior is a ½ inch inferior to the patellar apex. marker will go on the lateral side. I'll open up my collimator a little bit. Making sure that my leg is no rotation. Will still flex your foot for me a little bit?
Okay.
Thank you. Okay. All right, so I'm going to go ahead and shield my patient. Okay, stay real still for me. Okay, 70 at 5 mass. X-ray. All right, I'm going to go ahead and take my exposed IP out of the bucket. Place it off to the side. Grab a new IP, a clean IP. Insert it back into the bucket. Line it up. Patient shielded. This time, I'm going to take the entire leg and we're going to rotate it internally 45 degrees. So let's try that one more time. So I'm going to take the whole leg, internally rotate 45 degrees. Good. Now I'm going to, again, central ray is entering a 1/2 inch inferior to the patellar apex. Markers on the lateral side. Collimate as much as possible. Open up my field just a little bit. Good. Shielded. I'm going to keep with the same tube tilt of 3 to 5 degrees cephalic. 45-degree medial rotation, protection. All right, stay real still for me. My technique for my my technique for my medial, my oblique medial internal rotation is going to be 70 at 5 mass. Okay, stay real still. X-ray. Okay. I'm going to set my IP down, grab a new cassette, insert it. Okay, this time, this is to it, I need you to roll over towards the wall,
Okay.
that direction. My tube tilt will be between 5 to 7 degrees in angle. Change that slightly. I'm going to re-put the shield on her. I'm going to have her take her top leg over like she has it. I'm going to have her shift her leg forward, and I'm going to have her bottom leg, her affected leg bent 20 to 30 degrees. Can you bring this leg up a little bit more? Are you comfortable?
Sure.
There we go. Perfect. My central right enters 1 inch distal to the medial epicondyle. My leg is bent 20 to 30 degrees. And my left marker, thank you. My left marker is going to be on the lateral side. Tilted, shielded, left marker, 23 degrees angle. Collimation looks good. Okay. Stay real still for me. Real still for me. All right, again, my technique is 70 at 5 mass for my lateral view. I do want to place my sponge underneath the toes. I want to make sure that my epicondyle real still for me. X-ray. All right. Okay. I've asked my patient to turn over to a prone position, and I'll be demonstrating the PA axial projection camp Coventry method for the intercondylar fossa. I'm going to take my 8x10 and I'm going to place it underneath the knee. I'm going to have you lift your knee up a little bit for me. Okay, go ahead and place it down. I'm going to give my patient some support for the foot. The foot is going to be at a 40-degree angle, as well as my central ray and my tube. My source and distance is 40 inches. I'm aiming for the midpoint of the intercondylar fossa. Got my shield. My right marker goes in the light field. You okay?
Yes.
Let's do it? Okay. All right, so I'm going to call a mate as close as I can. That's good. All right, Mrs. DeWitt. I'm going to have you hold still. My technique for my knee is going to be 75 at a 5 mass. Okay? Hold real still for me. X-ray. Okay. Go ahead and release. Take the IP. Go ahead and lift your knee up for me. I'm going to grab a new plate. And now my projection will be a tangential projection, Settegast method. For this projection, I'm going to have my patient flex the knee 90 degree, placing the IR. I'm going to have you lift your knee up. Thank you. Go ahead and place it down. 90 degree, a little bit more please. There we go. There we go. You keep your foot flexed. Very nice. This time my tube angle will be 5 to 15 degrees cephalad, and I will be entering the patellofemoral joint space. And now I move my patient. So the central ray is entering the patellofemoral joint space. And what I need to do, if the patient can't hold the leg, I might have to immobilize the foot with tape. But it looks like she's able to do it. So hold real still for me. Real super still. Good. Okay. So my technique for my Settegast method is going to be 75 at a 4 mass. I'm going to drop my mass down to a 4. Okay, hold real still for me. X-ray. Okay. You can relax. Okay. Now I'm going to run my 2 images in the reader and see how they come out. Scan my first image, pop it in the reader. Oh, that looks good. I'll take my next cassette, scan it, pop it in the reader. Okay, looks like we're done. And now I'll be critiquing my images in my evaluation. Okay, so I'm going to let my patient go now. All right, Mrs. DeWitt, I'm going to help you lower you down. Okay. Lower your pet leg. You okay?
Yeah.
Okay, good. All right, so the radiologist, watch your head. The radiologist is going to review the images, and he's going to let your doctor know, and then we'll go from there.
Okay.
Okay, thanks
Thank
for coming
you.
in. Have a
Okay,
great day.
you
You know
too.
your way out, right?
Yes, thanks.
Okay. And that's it.